Have you ever climbed a flight of stairs you used to climb without thinking twice and found yourself standing at the top, hand on the railing, waiting for your breath to catch up? Or maybe you've noticed you get a little winded just carrying groceries in from the car, something that never used to bother you at all. If that sounds familiar, I want you to stay with me for this entire video because breathlessness after 50 is one of the most common things patients mention to me and also one of the most misunderstood. Some causes are harmless and easy to fix. Others are your body's way of asking for help before something more serious develops. I'm going to walk you through exactly how to tell the difference, and later in this video, I'll share the one warning sign that every person over 55 should know by heart, because in my experience, it's the one most people overlook until it's too late to overlook it. Hi, I'm Dr. Alex Mandell. I've spent my career helping people understand their bodies as they age, not by frightening them, but by giving them clear, honest, practical information. Here's the first thing I want you to know. Feeling a little more breathless than you used to is extremely common after 50. It doesn't automatically mean something is seriously wrong, but it also isn't something to simply wave away as just getting older. In my experience, breathlessness almost always has a specific, identifiable reason behind it, and most of those reasons are manageable once you know what to look for. Today, I'm going to cover the most common everyday causes of breathlessness in this stage of life, the surprising ones almost nobody connects to their breathing, the simple daily habits that can make a real difference, and the warning signs that mean it's time to get checked promptly rather than wait and see. Stay with me through all of it because the order I'm presenting this in matters. Each piece builds on the last. Let's start with the cause I see most often, and it's the one that surprises people the most because it has nothing to do with the lungs or the heart directly. I think of a patient I'll call Margaret, 66, recently retired from a job where she was on her feet most of the day. After retiring, her daily activity dropped significantly without her really noticing it happening. About a year later, she came to see me because simple things, walking to the mailbox, climbing her porch steps, left her more breathless than they used to. What we found wasn't a lung problem or a heart problem at all. It was deconditioning, a gradual decline in cardiovascular fitness that happens when activity levels drop. Your heart and lungs are essentially muscles and systems that respond to use, and when daily movement decreases, their efficiency decreases along with it. That's the simple version, and that's all the science you need here. Margaret's story has a genuinely encouraging ending. We started her on a very gradual walking program, nothing dramatic, just 10 minutes a day to begin with. And within about 8 weeks, she told me she'd climbed a full flight of stairs at her granddaughter's apartment without stopping to catch her breath. She said it was the first time in over a year she'd felt like her old self physically. If you're finding this helpful so far, take a moment to like this video and subscribe to the channel. It genuinely helps more seniors find this information, and I'll have several more important points coming up. Now, deconditioning explains a lot of cases, but it's far from the only cause. There's a second one that's just as common, and it hides in plain sight in almost everyone's medicine cabinet or pantry. I'll get to that one next, but first, I want you to understand why breathlessness from deconditioning feels different from the more serious causes we'll cover later, because learning to tell them apart is one of the most useful skills I can teach you in this video. Here's one that catches almost everyone off guard. One of my patients, a 72-year-old man named Walter, came in describing breathlessness that had crept up over a couple of months, along with feeling unusually tired and a bit pale. His wife mentioned she'd noticed he seemed to need more naps than usual, which wasn't like him at all. A simple blood test revealed the answer: anemia, a lower than normal level of red blood cells. Red blood cells carry oxygen throughout your body. So when there are fewer of them, your body, including your lungs and heart, has to work harder to deliver the same amount of oxygen, and breathlessness is often one of the first noticeable signs. What made Walter's case interesting is that the anemia itself had an underlying cause that needed attention, which his physician identified through further testing. Once that underlying issue was addressed, his energy and his breathing both improved substantially within a few months. I remember speaking with a 69-year-old patient who told me she'd assumed her breathlessness and fatigue were simply normal aging. She was genuinely surprised to learn that a basic blood test could explain so much of what she'd been feeling. That's something I want every person watching this to remember. A simple blood test, the kind your doctor can order in minutes, can rule in or rule out one of the most common and most treatable causes of breathlessness in this age group. So here's an open question worth sitting with for a moment. When was the last time you had a basic blood count checked? If you can't remember, that's worth mentioning at your next visit. But anemia and deconditioning are just two pieces of this puzzle. The next cause I want to cover is one that's especially important if you've ever been told you snore loudly or if your spouse has mentioned you seem to stop breathing for a moment in your sleep. Stay with me because this one affects far more people than realize it. This next cause doesn't show up while you're active during the day. It shows up while you're asleep, and most people only find out about it because someone else noticed first. I think of Harold, 70, whose wife finally convinced him to come in after years of loud snoring, punctuated by pauses where she'd watch him stop breathing for several seconds before gasping and starting again. Harold himself had no idea any of this was happening. He just knew he woke up tired, no matter how many hours he'd slept, and that he sometimes felt unusually breathless climbing stairs during the day. What Harold had was sleep apnea, a condition where breathing repeatedly stops and starts during sleep, often because the airway briefly collapses or narrows. Over time, this disrupts the body's oxygen levels and the quality of rest, which can contribute to daytime breathlessness, fatigue, and in some cases, additional strain on the heart. His children noticed something was changing even before his wife brought it up directly. They mentioned that he seemed to be dozing off during family gatherings, something that had never happened before. Once Harold was properly evaluated and started using a simple breathing device at night, both his sleep quality and his daytime breathlessness improved noticeably within just a few weeks. His wife told me she finally felt like she could sleep peacefully herself after years of lying awake listening for those pauses. If a story like Harold's sounds familiar, maybe a spouse or family member has mentioned you're snoring or breathing at night, don't brush it off as harmless. It's worth mentioning at your next appointment. Now, here's something I want you to consider. Deconditioning, anemia, and sleep apnea are all common, all very treatable, and all things many people live with for years without realizing it. But there's a fourth category I haven't touched on yet, one that involves the heart directly, and understanding it could genuinely make the difference in catching a serious problem early. We're going to get into that next, right after a quick reminder. If you know someone, a parent, a spouse, a friend who's mentioned feeling more breathless lately, consider sharing this video with them right now before we continue. It genuinely might be the nudge they need to get checked. This is the section I most want you to pay close attention to because it's the one where catching something early genuinely changes outcomes. I think of a patient, Dorothy, 74, who described breathlessness that was different from anything she'd experienced before. It wasn't just with exertion. She also noticed she felt more breathless lying flat at night to the point where she'd started propping herself up with extra pillows without really thinking about why. She'd also noticed some mild swelling in her ankles by the end of the day. Those particular details, breathlessness that's worse lying down, along with swelling in the legs or ankles, are patterns that can point toward the heart not pumping quite as efficiently as it should, sometimes called heart failure, which, despite its alarming name, is a manageable condition for many people once properly diagnosed and treated. Dorothy's physician confirmed this with some straightforward tests, started her on appropriate treatment, and within a few months she was sleeping flat again comfortably and noticed real improvement in her stamina. What I want you to take from Dorothy's story isn't fear, it's the value of paying attention to patterns. Breathlessness that's worse when lying down, breathlessness paired with ankle or leg swelling, or breathlessness that comes on with chest discomfort are all patterns worth describing specifically and clearly to your doctor because they help guide exactly which tests are needed. I also think of a patient named Eleanor, 68, whose breathlessness came on suddenly over just a day or two, along with a racing or fluttering feeling in her chest. That combination led her physician to check her heart's rhythm, and she was found to have an irregular heartbeat that was contributing directly to her symptoms. Once treated, her breathlessness resolved almost completely. Here's the most important thing I can tell you in this entire section, and I want you to really hear it. Sudden or severe breathlessness, especially when it comes with chest pain or pressure, pain spreading to the arm or jaw, sudden dizziness, fainting, or a bluish color to the lips or fingertips, is not something to wait on. That combination needs emergency medical attention right away. Call emergency services rather than waiting to see if it passes or scheduling a routine appointment. Emergency warning signs: seek immediate medical care if breathlessness comes with chest pain or pressure, pain spreading to the arm, jaw, or back, sudden severe shortness of breath, fainting or severe dizziness, bluish lips or fingertips, confusion or sudden weakness. These signs mean call emergency services right away, not wait and see. I share that not to frighten you, but because knowing this clearly ahead of time is exactly what allows people to act quickly and get the right care when it matters most. The vast majority of breathlessness after 50 is from far more manageable causes, but knowing the difference is genuinely one of the most valuable things you can take from this video. We're a little past the halfway point, and I have several more important sections coming, including the one factor most seniors completely overlook. If this video is helping, please take a moment to like it and subscribe so more people in this age group can find this information when they need it. Of course, breathlessness can come from the lungs directly, and I'd be doing you a disservice if I skipped this. Conditions like chronic obstructive pulmonary disease, often called COPD, and asthma can both cause breathlessness that develops gradually, often most noticeable during physical activity or in cold air. I think of a patient, Richard, 71, a former longtime smoker who'd quit decades earlier, who described a slow increase in breathlessness over several years that he'd simply attributed to aging. Lung function testing showed mild COPD, something that had likely been developing quietly for a long time. With proper treatment and a structured breathing and activity program, Richard told me he felt more in control of his breathing than he had in years, even though the underlying condition itself was something we'd manage long-term rather than fully reverse. His daughter mentioned that the real change she noticed wasn't just physical, it was that her father seemed to stop avoiding family outings the way he had been. He'd quietly been turning down invitations to walk around the zoo with his grandchildren or join family hikes, and once his breathing was better managed, he started saying yes again. And that's the kind of outcome that matters just as much as any number on a breathing test. I want to mention one more lesser-known contributor here. Extra weight around the midsection can make breathing physically more effortful simply by limiting how much the lungs can expand with each breath. This is a mechanical effect, not a moral judgment, and gradual, sustainable weight management, when appropriate and discussed with your physician, can meaningfully ease breathlessness for some people. Now, we've covered quite a lot of ground deconditioning, anemia, sleep apnea, the heart, and the lungs, but there's one piece I haven't touched on yet, and it's the one I promised you at the very beginning of this video. It's not a diagnosis at all. It's a pattern of behavior I see again and again, and in my experience, it causes more delayed diagnoses than any single medical condition on this list. Here it is. The single biggest factor I see standing between people and a clear answer about their breathlessness is the habit of explaining it away. I'm just out of shape. It's just my age. I've always been a little winded. It's nothing new. I hear some version of this from almost every patient before we even start testing, and sometimes they're right. It really is something simple like deconditioning. But sometimes underneath that same explanation is anemia or sleep apnea or an early heart or lung issue that's far easier to treat now than it will be later. I think back to Dorothy and Eleanor from earlier. Both of them told me, almost word for word, that they'd assumed their breathlessness was probably nothing before finally mentioning it. The only difference between a good outcome and a missed one in case after case I've seen is simply saying it out loud to a doctor and allowing a proper evaluation rather than quietly deciding for yourself what it is and isn't. So here's the takeaway I want you to remember above everything else in this video. You don't have to diagnose yourself, and you don't have to decide in advance whether your breathlessness is serious enough to mention. That's exactly what your doctor is there to help sort out. All you have to do is describe it clearly and let the evaluation happen. Let's make this practical. Here's exactly what I'd want you or someone I love to do. Mention any new or worsening breathlessness to your doctor, even if you suspect it's just deconditioning. Let an evaluation confirm that rather than assuming it. Ask about a basic blood test to check for anemia if you haven't had one checked recently, especially if breathlessness comes with fatigue or paleness. Pay attention to nighttime clues, loud snoring, pauses in breathing, or a spouse mentioning these things, and bring them up at your next visit. Notice the pattern of your breathlessness. Is it worse lying flat, paired with ankle swelling, sudden and severe? These details genuinely help guide diagnosis. If you have a history of smoking or chronic cough, ask about simple lung function testing. Start gentle, gradual activity. If you become less active, even short daily walks can meaningfully improve cardiovascular fitness over time. Know the emergency warning signs covered earlier in this video. Chest pain, sudden severe breathlessness, fainting, or bluish lips mean call emergency services immediately. Don't let embarrassment or the assumption that it's just aging keep you from describing your symptoms clearly and fully to your doctor. Here's what I want you to walk away with today. Breathlessness after 50 is common, and most of the time it has a clear, treatable explanation. Margaret got her stamina back through gentle activity. Walter's energy returned once his anemia was addressed. Harold finally slept peacefully again, and so did his wife. Dorothy and Eleanor both got real answers about their hearts and were able to start treatment that helped. Richard started saying yes to family outings again. The thread running through every one of these stories is the same. They described what they were feeling clearly and honestly to a doctor who could help instead of deciding on their own that it was probably nothing. That's the choice that's available to you too, starting with your very next appointment. If this video helped you understand your own breathing a little better, or reminded you of someone in your life who's mentioned feeling more winded lately, please share it with them. And if you'd like more honest, practical health guidance made specifically for this stage of life, make sure you're subscribed. That's exactly what this channel is here for. Take care of yourself and take your breathing seriously, not anxiously, just seriously. I'll see you in the next one.